Hey there. I'm coming on today to talk about mental health. So I work in mental health. I manage a mental health unit. And when I started my nursing career, ever since starting my nursing career, one of the things that I've done, one of the areas that I've worked in is mental health. And I think because I'm so involved in mental health every day that I forget about the stigma that comes with it to an extent. Unfortunately, the stigma that comes with it. So when I'm working with patients and the teams that work with our patients, it feels so normal for me that this is something that humans go through in so many different ways. Mental health there's so many different facets of it. And then I will have an interaction out in the general public that snaps me back into the realization that, dang, other people still aren't seeing this as human, as something that can come with the human process and human being, and that is so limiting in so many ways. And I think one of the huge ways that it's limiting is that it prevents people from seeking help because of the stigma, because of fear of being judged. So much judgment I see. And because I have a transgender daughter, and I see what she goes through, and then I am with her in public and see how so many people respond in positive ways, and then I see people who I would expect to, people that we know and people that see what she's going through and know what I've gone through with worry and things like that as her mother, and the pain and the anguish that comes with just life in general in those circumstances and things like that. And I see how those folks who I would expect who know that perspective, to have an understanding and a compassion, respond in ways that are not compassionate and not understanding. It snaps me back into that reality that there's so much work to do in the realm of mental health and meeting people where they're at and helping them to understand and helping them to open up the parts in themselves, to work through the parts in themselves, to work through the perceptions that have been passed on to them, the perceptions that have been put upon them, in order for them to be accepting and to release judgment. Not only releasing judgment for anybody who may be experiencing a mental health concern or a diagnosis, but inner judgment towards themselves, which is so limiting for people when they have those self-judgments. It's so limiting for them to seek help. What is my family going to think? What are my friends going to think? I don't want anybody at work to know about this. I don't want anybody to know that I'm going through this. How isolating for them. how isolating. There are, I think, there's so many thoughts that I think about this. In order for people to grow and to accept what they're experiencing, I think ultimately they have to feel safe. They have to feel like they're safe. And that's like number one on Maslow's hierarchy of needs, is safety. You have to feel safe. And until people feel safe, they're not necessarily going to be able to work towards self-actualization. And so safety is an aspect of it. And I think another an alert just popped up on my phone, so yay, I'm lit up. Another aspect is that because we don't feel safe, we compartmentalize different pieces of ourselves, and we close off to different pieces of ourselves. And I really think that contributes to anxiety, depression. There are absolutely so many different ways in which and so many reasons why somebody might be experiencing either a mental health crisis or a more chronic mental health condition. There's chemical processes, there's spiritual crisis, so many different ways. And I really do believe that, number one, they're either not feeling safe for whatever reason. It could be physically, mentally, emotionally. There's something there that's preventing them from feeling safe, and additionally compounding to it, causing them to compartmentalize and close off different aspects of themselves. So as I work with patients in general, teams in general, people in general, and I work with understanding energy and how energy works and moves through us, I see as well how the fact that our energetic bodies, the energetic parts of us are, I think a broader message that we get from society is that is woo, and that is out there, and it's only something that people are born with, to be able to connect with that. I don't think that helps either, those messages, because again, that's also compartmentalizing parts of us, or even shutting parts of us that actually are there to help us experience life and process these experiences. So I see my whole career coming full circle, it all interweaves together. Everything the path that I'm, that is unfolding in front of me and will continue to unfold, is weaving together. Here, Kelly, here are these patients, and here is these patients that have they're going through these life experiences, and here's this information over here that can help you help them, and here's this way of healing, and here's this way, that way. So it's all coming together. Ultimately, what I want to share today are those points that I just made, and I want to share that there are so many resources out there, while at the same time recognizing that it can be difficult. There are barriers yet to mental health care is tricky to navigate, and I'm so sorry about that for anybody who's going through it. I'm in the system. I have awareness of what's available, and it's still so difficult to navigate for family, for friends. So just know, here are some resources for you. 988 is the National Suicide Hotline. Anybody can call that number and get help and talk through things with people. I have loved ones who have called that number many times and have found it to be helpful. 988. There are also NAMI, N-A-M-I, is a resource that you can go on the internet. I think it's NAMI.com, but I'm not 100% sure exactly what the website is, but just know NAMI is a huge resource for mental health. What are some other ones? Oh gosh. Most counties have a local crisis resource center, so you could type in crisis resources into Google and come up with some help there. There are different levels of mental health care, so you can see a therapist, you can see a psychiatrist. Psychiatrists are going to be the folks who are prescribing medication. Therapists are going to be the ones that you gain that, you visit them regularly, you get that therapeutic relationship with, where they hear what is going on for you, they help you process what is going on, and work with you in that way. There are day treatments, which are usually you're meeting in a day treatment about 3 days a week for a few hours each of those days for about a 3-month period. There are partial hospitalization programs, and that's where you're meeting probably 5 days a week for 6 hours a day with groups and things like that. There are inpatient mental health units, and when you go into one of those places, it's because you're in a crisis and you need that acute stabilization. Typically you're going to be started on a medication if you haven't been on one, or they're going to work with adjusting your medications to help you get back to a more stabilized space where you can be successful out in your everyday life and feel balanced and just stabilize. You're able to interact in your life and be in your life. There are long-term, what we call an IRTZ. Here in Minnesota, we call it an IRTZ, an inpatient residential treatment site, where you essentially go live in this place for a few months, usually around up to 90 days, I believe. And you have programming every day, groups, and they usually are working with a dialectical behavioral therapy or cognitive behavioral therapy for their group programming. There are DBT, CBT, so cognitive behavioral therapy, and dialectical behavioral therapy groups that you can attend outpatient. There are resources out there. So as I continue to walk this path that is unfolding for me and bringing in these different aspects of things, I will continue to share what I'm guided to share with you. And I would invite you, if you have any questions at all, to reach out. Oh, a lot of workplaces have an employee assistance program. That's what we call it where I work, EAP. That can be very helpful in helping you find resources if you're experiencing anything with mental health concerns, or a loved one or somebody you know. And my goodness, if you aren't experiencing a mental health concern yourself, I think you'd be hard pressed to find somebody you know or love who isn't. So let's continue to work on letting people, allowing people, holding space for people to move through their experience without judgment and without stigmatizing them, and practice awareness of where you may be judging yourself or judging others, and get curious about that. You know, where's that judgment coming from? Is it from a TV commercial I saw? You just practice releasing that and expanding in that way. All right, guys, enjoy the expansion.